So adoptions. The ultimate goal of any animal in a shelter is to leave and to be adopted. So can we put a pet that's still on treatment up for adoption or in the adoptions floor? I think you have to look at it in your shelter. There are definitely some risks. So to other animals, what do you think the risk of a cat passing to a dog coccidia? Is there a risk? Not as much. Remember, it's very host specific. So they can get pseudoparasites, but they don't typically cause clinical signs. So low risk to other animals that are different species, but if it's a cat to a cat, there's definitely a risk there. Staff, volunteers, and adopters. So is this a zoonotic parasite? No, except for toxo. So just be aware if you're dealing with toxoplasma. Some possible pre-adoption steps that you can take to kind of safeguard the adoption process. You could have info signs on your kennels and cages saying, I have coccidia, but don't worry, I'm on treatment. Info sheets for the adopter, so telling them what coccidia is, how you're dealing with it, possible things to keep an eye out for. A waiver, so as long as the adopter knows what they're adopting and that their pet will have coccidia initially, but that they are on treatment. Main thing is that they're aware of it. And you want to check back in after adoption. Maybe you can call those owners and say, hey, how is Fluffy doing? Does he still have diarrhea? And if so, you might have to pursue further treatments at that point.